And I know you've recently done some reviewing around best interest and the possibility that there might be some patients in who it's in their best interest to withdraw some life-sustaining treatments, such as the feeding tube. What are you doing as a manager around supporting staff?
We are first making staff aware of the new guidelines that has been published, and we are asking staff to bring to our attention if they have any concerns or questions, if they want to ask about the process. So that's where we have begun discussing this topic.
And what emotions do you think it might bring up for staff, and how might you support that and support them?
It will bring out quite a lot of strong emotions with staff, especially with patients who have been with us for a long period, because staff have known them, staff have known their families, and staff have cared for these patients for a long time. So I'm not sure what type of emotions, but I'm sure there will be very strong emotions. Probably more if they feel that the patient was having a reasonably good quality of life, or if the patient was able to respond to some sort of stimuli.
Yeah. And do you do anything like Schwartz rounds when you've had a patient die anyway? Do you ever do kind of, I don't know, some kind of meeting or ritual or ceremony for the dead patient?
We do a regular debrief session with the whole staff team when a patient dies. And especially senior managers go to meet the bigger group of clinical staff if the death was sudden and if we knew that the death might have affected staff emotionally. So we do that routinely, almost with all deaths.
Right, so if there is a death through a withdrawal of a feeding tube, that again you'd have some kind of review meeting and support for staff.
Most likely, yeah. And we are thinking about putting all these things as part of the policy, and we want to make sure that we are covering all the areas to support staff, patients and their families.